Hi, again, this is Yannick Dentist. I am a family nurse practitioner based in West Palm Beach, Florida. And today we're going to be discussing about diabetes knowledge. So my teaching today is to give you knowledge, education to educate you about diabetic because especially diabetic type 2, this is the most type I've been treating and seeing. So it's on the rise and we need to know, I mean, when I said we, the population, we need to know about that disease, and um, it's on the rise. So I would like to greet everyone and to welcome everyone who has decided to listening to that topic. If it's in your heart, if you have it, or you have a loved one who has diabetic, so that should be good for you to gain some knowledge and you can share it too. So that's why my goal is to share my knowledge. I've been a nurse for 30 years and a nurse practitioner for 20 years. So I've been dealing with those diseases, diabetic, high blood pressure, heart attack, you name it, infection. So every time I come, I'm going to address different topic. So hopefully you can have some knowledge because I believe people should be informed, regardless it's financial, it's financial, health, and if you are healthy, at least you can enjoy your financial. If you're not healthy, even though you have billion or million, you cannot enjoy it. So that's why my goal, my vision really is to help people to get knowledge. This is the goal of my videos, is to educate whoever wants to gain those knowledge, and it's no mean to treat no one. So having said that, I greet everyone. So the focus on my video will always be on health prevention and disease no, sorry, health promotion and disease prevention, and general knowledge about health. So I will be discussing about lab works because I believe we should know what your lab result mean. And apparently, people have issues with that. So if you have a general knowledge that will help you, sometimes you can guide your provider, what you need. So let's see what God said about healing. So if we go to Psalm 6, verses 2 to 3, we read it as follows. Psalm 6, verses 2 to 3. Have mercy on me, O Lord, for I am weak. O Lord, heal me, for my bones are troubled. My soul also is greatly troubled. But you, O Lord, how long? So as we can see, when you're weak, so it's kind of, you're weak. There's something doesn't, you can be weak for different reason. And the Lord promised us He's going to heal us. But that's why God gives you the healthcare professionals, the nurses, the physicians, the nurse practitioners, the physician assistants, the psychiatrists. So to help you to help you to find out what's going on, and they can treat you. So my main focus is physical. So when the verse 3 said, "My soul is greatly troubled." So human, we are physical, mental, emotional, and psychosocial. So my focus is mainly physical. So I will leave the soul for the psychiatrist and the psychologist to deal with. So let's tackle now the diabetes knowledge. If you follow with me with the poster, so everything I'm going to say is there. So whatever, you can go back to that video to refresh your memory. And if you have your loved one, or if it's for you, your neighbor, your friends, spread the knowledge. People need to know about education. We need to be educated, because sometimes we don't do something is because we don't know. If we know, we will do it. So currently in United States, they have approximately 29.1 million people in the US who is diagnosed with diabetes. Okay, though they have diabetes. So this is an epidemic, and he's getting worse because people don't follow their diet. Even though you prescribe them their medication, they don't take their medications. Exercising, some of them, they don't exercise, So, yeah, so we really need to be serious and try to do what we can do so we can stay healthy, and the complications we can really slow. If we can slow it or eliminate the complications of diabetic, this is the goal. This is the best goal. Number of people with diabetic in the US by race. So according to American Diabetic Association, the non-Hispanic white, we count for 7.6%. The Asian American count for 9%. Hispanic count for 12.8%. African American counts for 13.2%, and American Indian Alaskan count for 15.9%. So you can see it's a lot in all the races. We have people who have diabetes. Some races has more, but the take-home message, everybody, any race can have that. Or in adults, type 2 diabetic accounts for about 90% to 95% of all diagnosed cases. So that's meaning diabetic type 2, we found it most in adults, because you really type 1, it's in children most of the time. Also, we know also that it's very costly. To be diabetic is very costly because the medication is costly, the treatment, the side effect. So we have like in average $13,000, okay, to treat the medical expenses per year. In average, for one person, can be around 13,700, almost 14,000 per year, and that can be more depending your complication. If you have to have, if it's affecting your eyes, your legs, if you have wounds, so that can be very costly. those diagnosed are also at risk for different sort of problems. So they are at risk for high blood pressure. So if you follow with me with the poster, it's all there. So they said, okay, people who is diagnosed with diabetic. So mostly I'm talking about diabetic type 2, people who need insulin medication, right? So those people, they're at risk for high blood pressure, for blindness and eye problems, heart disease or stroke, and kidney disease. So who is at risk? As I said before, nearly a third of all American adults are at risk of developing diabetes. So one third, that's a lot. Also, like we know, diabetes is on the rise. Why it's on the rise? Mostly the lifestyle. People, they are exercise less. We have and the diet, American diet. We eat a lot of sugar, a lot of fat. So 3.7 million deaths is caused by diabetic and high blood glucose. You can have high blood glucose, but you're not diabetic yet. So they account 3.7 million deaths, people who died. They die from diabetic diabetic and high sugar level. And in total, so also 1.5 million people die from diabetic alone. So it's a lot of deaths. It's a very concerning disease. So this is a disease people shouldn't take that lightly, because it's in a rise and it causes a lot of issues. Again, that's 1% in 11 person. 1% in 11. So that's meaning if you take 11%, okay, you take 11%, 1% will be diabetic. If you take 22%, 2 of them will be diabetic. So what are the main types of diabetes? We have 3 types. Type 1 diabetes. So that type 1 is it's when your body does not produce enough insulin. So usually those people, they have a pump, insulin pump, so who can deliver the insulin automatically whenever their blood sugar goes down. And the second type is type 2. This is the type they said that 90% to 95% of all diagnosed cases, they are adults. So it's the type 2. Usually the type 2, your body produces insulin, but can't use it well. So that's why we have to supplement. That's why we have to give extra insulin. But we start with pills first. So you have your metformin, you have your glipizide, and then after that, some people they cannot. If you cannot control it with the pills itself, then we can use the insulin. And also the third type, we have gestational diabetes. The gestational diabetes is a temporary condition in pregnancy people. So when the lady, they are pregnant, sometimes they develop that condition, gestational diabetes. So they have diabetes when they are pregnant, Usually, after they deliver the baby, their blood sugar turn back into normal. However, they should watch their diet because usually in the late stage of their life, when I'm in late stage, meaning when they become like 40, whatever, 40, 50s, they can develop it because they are at risk. So to do that, to develop that. So what are the consequences of diabetes? There are a lot of consequences, and some of them is major. So diabetes can lead to complication in many parts of the body and increase the risk of dying prematurely. So this is not a disease people can take lightly. So consequences are you can have a stroke because because that can affect your brain. You can be blind because it affects your eyes. You can have heart attack because he affects also your heart. And you can have kidney failure because diabetic affect your kidneys, and that can lead to dialysis. Some people, before I thought that high blood pressure was the culprit for dialysis, but really, for dialysis, but really it's sugar. It's when you are diabetic and you don't control it. People really take it lightly. They don't take their medications. They don't follow the doctor's advice, and that will kill your kidneys. Okay, you're going to become into kidney failure, and then after that, you're going to need to be on dialysis, and also amputations. Okay, because what happened is that when you have diabetic, what happened is you have poor circulation in your lower extremities, your legs. God forbid you have ulcers. That is very difficult to heal. So that's why my patients who was diabetic, I always told them, be careful with your feet. Foot care is, I cannot say it again, how important foot care is. Okay, and I'm going to take that occasion to also say, when you are diabetic, please go to podiatrist. Don't let, I wouldn't advise you to go for pedicure, because if they cut your toenails too short and you have a wound there, a laceration, if you're diabetic and you don't control your sugar very well, even though if you control it, because the circulation is already impaired by being diabetic, so that's why it's not advisable to go for pedicure. You need to see anybody who is diabetic should see podiatrist, because they are the one who is specialized to cut the toenails, and at the same time they can inspect your your circulation in your foot, in your toes, and to see if you have any necrotic spots, sites, so they can address it. So the amputation caused by, like, say, what I see somebody, they have bypass, and it's very difficult. When you have bypass, sometimes for diabetic people, it's very difficult to heal. So they end up having non-healing ulcer or non-healing wound, and that will lead eventually to amputation. So it's a lot of consequences. So that's why it's good if we can prevent diabetic, is good, or if it's not, at least control it. And there is one blood test called hemoglobin A1C. Hemoglobin A1C, we should do it every 3 months in order to adjust your diabetic medication. So if your doctor or your provider don't order that blood test, which is hemoglobin A1C, remind them, because I have patients who I follow, and then they don't do that test. They didn't do it for a year, and I asked them, how come you are diabetic and you don't do hemoglobin A? How come you don't do that hemoglobin A1C? And their response is that I don't know. So please, if you are diabetic, hemoglobin A1C is a must. You need to do it every 3 months. So the goal is to have an hemoglobin A1C less than 6. This is the goal. If you have hemoglobin between 6 to 2, 6.1, 6.2, you borderline. We need to follow all of that. So when your hemoglobin is like 6.5 and up, they're going to start treating you for diabetes. So that's why it's primordial to double check, to test your hemoglobin A1C. And the beauty of that blood test is that it calculates your blood glucose level for 3 months. So even though you eat or you don't eat before that blood test, it doesn't make any difference if you eat or not, because the number we have is calculated your blood sugar over 3 months period. So that's why this is one of the best tests we do to really managing when we manage people with diabetic, and to adjust the insulin or the pills. Also, when you are diabetic, they can put you on different insulin. So we have Novolog, we have regular insulin, and now we have the newest one we call Lantus. This is the long-acting insulin. And you have Aspart, which is the fast-acting insulin. And we have the newest one too. So your provider, you need to follow closely with your provider. They are the one who knows which one to put you on, the dosage and everything. And please, you need to follow with an endocrinologist. An endocrinologist is the specialist who specializes in endocrines. So, like if you have your thyroid problem, if you have, diabetic, so you need to follow with one of them, endocrinologist. And when your blood sugar is controlled, then they can tell you, you know what, you don't need to come to see me like every 3 months. You can follow with your primary care provider. So if they told you that's what you have to do, that's fine. But I will advise you, please, if you are diabetic, follow up with an endocrinologist, because they are the one who specialize to manage blood glucose level. So check your blood sugar is important. You need to check it on a regular basis. Some people, when your blood sugar is not controlled, sometimes you have to do it 4 times a day. You have to do it before meals and at bedtimes. Or some people do it before meals 3 times or 1 time a day, or sometimes, it's depending what your provider told you. Whatever the provider told you, please, you follow. Because even though you are on pills alone, sometimes you might be on metformin or glipizide. even though you don't want to check your sugar every day, but at least I will check it twice, 3 times a week. At least you need a baseline. You need to have a baseline of your blood sugar. Why? If you have any symptom, let's say you become very thirsty, you want to drink, because this is one of the signs also when your blood sugar is high, elevated. You are thirsty and you pee and you urinate a lot. So let's say your blood sugar, the baseline is like, let's say 150, 140, 120. All right, so your blood sugar should be less than 120. So let's say your baseline, you are diabetic, is 130, 140. And one day you wake up, you're very thirsty. Suddenly you're thirsty, you're drinking. You go to the bathroom like, I don't know, every half an hour, you want to pee all the time. And you said, let me check my blood sugar. And my blood sugar is 300, it's 400. Okay, so that's no good. So something is going on. You need to call your provider. You need to go and see your provider so they can adjust your medication. Your medication needs to be adjusted. So when you go there, what they do, they're going to repeat your blood sugar, and they will do your hemoglobin A1C. They will do that. This is the real blood test, so can tell your provider that how your blood sugar is doing. So according to that level, if your hemoglobin A1C is higher than previously, than the hemoglobin they did before, they will adjust either your insulin, your pills, or both. But I'm saying all this to tell you it's very important to follow up. It's very important to check your blood sugar, to follow up with your primary care provider or your endocrinologist. So the symptom of high blood sugar is what? The symptom of high blood sugar, you always hungry, you always tired, increased thirst, you're thirsty, frequent urination, nausea, you can have nausea as well, blurred vision, because remember it affects your eyes. This is those symptoms. So if you are diabetic and you have those symptoms, check your blood sugar. Sudden weight loss, that happen too. So if you have sudden weight loss, think about your blood sugar. And if you have sexual problems, that can be one too, especially male. And slow healing of wound, wound like ulcer. If you have an ulcer or a wound, especially like I said, in lower extremities, like feet, your foot. So if you have a heel who has difficulty to, if you have a wound who has difficulty to heal, think about your blood sugar. Maybe your blood sugar is not controlled, or you are diabetic if you're not diagnosed yet. So make sure you follow that. And also the complications of diabetic, also the complication is permanent kidney damage. So that's why the people, they end up in dialysis. Cerebral vascular disease, which is the stroke. You have the eye damage, diabetic foot ulcer, that can lead to the amputation. One complication also is peripheral neuropathy. Peripheral neuropathy, this is this is the nerve pain you have on your feet. It's like tingling, burning sensations. So you have that pain, you don't know where that pain is come from. He's come from there. So we have, they have medicine they can give. So contact your doctor. They can prescribe you some stuff for those nerve pain, okay, like tingling, burning sensation. We call that peripheral neuropathy, nerve pain. And also complication you can have coronary heart disease. So again, having that disease, which is diabetic, that can affect every part, in your body, your brain, your eyes, your heart, your kidneys, your legs. So, who should be screened for diabetes? Who should be screened? People at risk. So, talk to your doctor for screening if you are older than 45 years old. If you have a body mass index greater than 25. So the body mass index, usually your provider can do that, can measure you. Nowadays, I see the scale. Some scale have that, because I see some scale, the scale when you take your weight. Some scale they have automatically they have the body mass index. So they said that they said the research, and also American Diabetic Association state that if your body mass index is more than 25, you should be screened. And also, if you have a family history of diabetes, for instance, if you have your dad who was or is diabetic, or your mom or your brothers and sisters, so you are at risk. And if you have or had gestational diabetes, so like I said before, if for ladies, if you were pregnant and the doctor told you have gestational diabetes, so when you're getting older, like 20, when you're getting older, 45, 50, you should be screened, because you are at risk to develop diabetic type 2. All right. And the food, if you look below the diabetic food pyramid, so they really advise you to eat, people with diabetes, but it should be for everyone though, to eat lower carb, right? Fruits, and eat beans and legumes, like vegetables, moderate carbs, veggies. So you can eat protein, healthy fat like in the fish, in the nuts, like walnuts, avocado. This is the healthy fat, right? Olive oils, healthy fats. And also non-starchy, lower carb vegetables, herbs, and spice. They recommend you to eat that, non-starchy vegetables, like your tomato, your cabbage, your kales, your what is that? Especially your greens, carrots. So it's recommended. And food, they are not recommended for diabetes. It's bread, especially white bread. Sugar is not recommended. Pasta is not recommended. Rice, corn, potatoes, junk food, of course. And they forgot something. Sodas. Drinking soda, they are not recommended as well. Um, okay, steps. We have 7 steps for better living with diabetes. 7 steps. So, according to American Diabetic Association, the 7 steps are: eat healthy, okay, uh, be active, monitor your blood sugar, take your medication, problem solve. I mean, if you have a problem, solve it. Like, let's say, okay, I'll come back with that. And cope well and reduce your risk. All those things I'm telling you is in the poster. It's on, yeah, it's on the poster, so you can follow it with me. So the 7 steps. So eat healthy. You can, it's like make healthy food choices, because sometimes, we don't make healthy food choices. And that happened to me too. Sometimes I feel like eating some junk food, but I have to remind myself, if I'm eating junk food, um, that's no good for me. So I have to remind myself, if I want to eat something, go get my salad, my lean meat. You need to eat healthy, and watch also your portion size. That's very, very important. I meet some people who said, I don't know why I'm sick. I don't know why I have high blood pressure. I don't know how I have diabetic, because I'm eating healthy. I'm eating fruit, vegetable. But when you see the size of their meal, you said, oh no, they eat for 2, 3 people. So that's too much. Even though you're eating healthy, um, that's not healthy. Even though yes, it's healthy, but you're eating too much. So you deliver too much sugar, too much protein, too much fat at this, one shot in your system. That's no good. So watch your portion, eat the right size of portion. You might eat often, but the size, watch it. And also you need to eat, yeah, that's why you eat regular meals. You don't, some people like to skip. I have patients that, oh, I only eat once a day. Really? Yeah, at three, like 3, 4 o'clock. No, no, no. You need to eat. As a matter of fact, so many research said that your breakfast, this is your best meal. So you eat your breakfast. You have all your you have your carb, you have your grain, your protein, your breakfast. You eat a good meal. So I'm not telling you how many meals you should, but usually it's is 3 meals. Some people don't eat three meals. They eat 2, and depending how they balance it, so that could be fine too. Be active. They said to exercise 5 days a week. Okay, and be active 30 minutes a day. And they recommend for you to lose 10 to 20 pounds if you are overweight. So if you are overweight, um, they advise you to lose 10 to 20 pounds, and that can make significant result to your blood glucose or your hemoglobin A1C. And also to monitor or check your blood sugar level. And you need to know your baseline of hemoglobin A1C. Because let's say you have diabetic type 2, and then when they discover that your lab work, your hemoglobin A1C was, let's say, he was 910, which is extremely high. Okay, they put you on metformin. Let's say, for example, they put you on metformin 500 milligram twice a day, and then after 1 month, after 4 weeks, they you go back, you repeat it, in the beginning, but it should be every 3 months. But maybe your provider will make you come back, in 4 weeks in the beginning, to check your blood sugar. Okay. And they said, okay, your blood sugar, it's not that high. And in 3 months, you go back, your hemoglobin was like, your blood glucose level, which is your if they do it, they can do the blood glucose, or they can do every 3 months your hemoglobin A1C. If your hemoglobin A1C, let's say, was 9 or 10, and then after 3 months you go back for follow-up, and your hemoglobin went down to, let's say, went down to 7, which is good, which is excellent. So that's meaning the path, the treatment, the medication you are taking is working. If your hemoglobin was 9, 10, and then it went to 11, that's meaning you need more medicine. You need more pills or more insulin. Whatever the treatment you and your doctor, they have decided. Okay, and also you need to check your blood pressure also, because remember, when you are diabetic, you are high risk to have high blood pressure too. Usually they said they are cousin. If you have diabetic, you might have a high blood pressure too. So make sure that you check your blood pressure on a regular basis. Check your cholesterol. Your eyes, you need to check your eyes every year. Go to ophthalmologist and check your eye, because the blood sugar, elevated blood sugar affect your eyes. So it's important you check your eyes. Go to eye doctors every year and get exam. And also you check your feet and your teeth. So how you can reduce the risk? So you can reduce the risk of diabetic by quit smoking. Smoking play a big role too. Smoking, it's, everybody, we know that smoking is very bad for our health. Is very bad if you have a high blood pressure and diabetics. That goes hand to hand. And you do regular health exam. Go to your doctor, your eye doctor, your foot doctor. This is the podiatrist, and your dentist. You need to check your eyes, which is your ophthalmologist. You need to check your foot, which is your podiatrist, and you need to check your teeth, which is your dentist. So those three, as a matter of fact, you have 4 specialists, very important. When you have diabetic, you have your endocrinologist, which is the doctor to follow your blood sugar. Okay. And you have your ophthalmologist for your eye. You need to check that doctor every year for eye exam. You need to check your podiatrist for foot care. Foot care is very important. I would not advise you to go to pedicure if you are diabetic, because you need special attention, special care for your toe. It's not everybody who can cut your toe nails. So have a podiatrist taking care of your feet. It's important. It's prevention, and that can save you a lot of headaches. And also the dentist for your teeth. And see your doctor on a regular basis, okay, for for checkup and for testing. Like every 3 months. Every 3 months when you go, they're going to do your complete blood count. They're going to check if you have anemia, if you have infection, because when you're diabetic, also you're prone having infection. UTI, UTI stand for urinary tract infection, and that need to be checked. So on that, please follow your doctor. Whatever medication they give you, you need to take your medications, and do not stop your medication without your doctor's advice. I mean, your primary care physician, your PCP advice. They need to know. You need, if there's a reason. Sometimes, I heard patient told me, they give me metformin, I stop it because I have diarrhea. Yes, metformin, yeah, it's one of the side effects. You can have diarrhea, but you need to notify your provider. Maybe the provider will give you something else, or maybe the provider will cut it down. Whatever they decided to do, but you cannot stop your medicine like that without notify your provider. Please notify your provider. Work together with your provider, because by doing that will lessen the complication. That's why we want. That's why we want. We don't want complication, or we want to minimize the complications. Very important. So on that, do not forget to eat healthy. Okay. Also, you should work with a nutritionist for guidance. What kind of diet, what kind of food, you can mix, you can eat, and lose weight. They said patients who lose as little as 5% of their body weight can dramatically reduce their risk of developing diabetes. Only 5%. You can see that difference in your disease, in your lab works, your hemoglobin A1C. And regular exercise, that's a big help also. Patients who exercise on a regular basis can cut their risk of the diabetic by half. Could you believe that? Exercising regularly can decrease your diabetic risk. The risk for you to be diabetic, if you exercise on a regular basis, you can decrease that risk by half. So this is the prevention right there. So on that, I will wish you, best of health, and thank you for listening and following the poster with me. And then and please, I am planning to release 1 or 2 videos every week. It's all about education, about health promotion and disease prevention. I'm going to educate you guys about lab works, okay? Because I see also we need the population. We need to understand the lab work. We need to understand CBC. CBC is complete blood works. So when the doctor or the provider told you have anemia, what they meant, if they give you, and you need to ask them for a report. You need to have report of your lab works, and you need to follow. You need to understand. So I'm going to educate you guys about it, because this is something. I think lab work is something is not well understood. Even though me, as a nurse practitioner, as a nurse for so many years, I had problem before to understand it until I work in hematology, the blood disease. Yeah, I used to work there, cancer, and then I will understand the lab, the result. So I'm going to take that responsibility to teach you guys about the lab work. Let's say you have because lab work is great. This is how we discover so many things. In lab works, we can discover if you have infection, if you have anemia, if you have thalassemia, sickle cells, kidney failure, liver failure. You name it. And here in Florida, even though it's sunny, we have sun, but the vitamin D level is low. Is very low. So this is another one. We can do vitamin D level and check it to see how much is it, and then if it's low, we supplement. Folic acid, all those things. I really want you guys to really knowledgeable, to have knowledge about the lab work. So I'm going to discuss that. And vitamins, different type of vitamins. We're going to talk about vitamin A, B, C, vitamin D, vitamin, you name it, B12. So watch for my videos. So I'm planning to release 1 to 2 videos every week. At least 1, but maximum 2. And my main goal, is to teach you guys. I want you guys to take your health seriously, and by educating yourself, you will know what to do. You will know when to ask for help. You will know when to go to the doctor. You will know sign and symptom, how to deal with it too. And also, when you are on medication, do not neglect it. You need to take your medication. One more point also, one more thing, natural medicine for diabetes. So the research shows also that onions, garlics, and cinnamon, they are very good to take when you are diabetic. All right, so a few years ago, personally, true fact, my hemoglobin A1C was 5.9, so that's meaning borderline. All right, 5.9. So I said, oh boy, what I'm going to do? So I read, because on natural medicine, and there's a book who said, they were talking about cinnamon. So I said, okay, so the capsules. So I went to a health food store and bought cinnamon capsules, 2,000 milligrams. So I took it. I took it for a couple of months, maybe 4 or 5 months, and I went back to my primary care physician. And guess what? My hemoglobin A1C from 5.9 went to 5.5. So, from borderline, and I become normal. So I believe on those natural stuff. When they told you onions, garlic, cinnamon. So read about it, take them, use it, in your food. The supplement, you can buy it, but notify your provider. I'm not telling you, I'm not prescribing you things. I'm just give you the information to educate you what is there, what people do. So yeah, that's it. And then again, watch my next video, and do not forget to like and subscribe, because when you subscribe, whenever I posted a new one, they will notify you. And if you want to watch, to listen, so you can listen it. On that, I wish you the best of health, and we will talk next time. Bye-bye.